The South Carolina Department of Health and Environmental Control is partnering with different EMS agencies across the state to increase awareness of opioid abuse and help save lives.
There's certainly demand surrounding this. Fox Carolina's Jarvis Robertson is live in Greenville this morning with a look into how the county is benefiting from those efforts. Jarvis?
Yeah, that's right, Ashley and Mac. Now, this is all part of DHEC's COPE program. That stands for Community Opioid Pandemic Paramedic Education, Now, with Greenville County having the leading cause of overdoses due to fentanyl, I wanted to take a closer look at how they're treating the problem. Greenville County EMS tell me that once they've treated a person for overdose, they then circle back in probably about a week or so just to check in, see how they're doing, and offer any educational resources. And it's a collaborative effort with the Phoenix Center.
It is a disease, and a disease that needs to be treated.
And paramedic Jonathan Peoples is treating the fentanyl epidemic with Narcan whenever he's called to the scene of an overdose.
I read every report that EMS, fire, or the police where Narcan has been used, and I think we had 100 last month. And this time last year, it was probably 60 in the month.
Narcan has become such an integral component to the fight. The Phoenix Center has been providing it for free since 2017. I asked the COO, Jessica Owens, how many of these life-saving boxes were given out last year.
In the past year, about 2,300.
A decision that's reversing course, stopping death.
Every client that comes through the Phoenix Center is offered Narcan free when they come for their initial intake. We're able to actually get to their caregivers as well, and we go out into the community and give it to any community member who is interested in assisting.
The number of saves outweighed the number of deaths because bystanders are there to administer. I asked him what are the signs that indicate when Narcan should be given.
There's somebody who's not breathing, they're blue, or they're breathing shallow, less than, 10 times a minute. Lips are blue, they're not with it. And then, of course, you can check their pupils if they're pinpoint.
And if more than one dose should be given.
A lot of times now the fire department and police departments are using the inhaled Narcan, so they'll have given it before we get there. It takes a little bit longer to work, and sometimes you need to have an extra dose or half a dose of the IV.
Despite how you feel about fentanyl, it's a crippling substance that can change your life forever.
Even if you feel like it's not your child, your niece, your nephew, or your mom.
Every socioeconomic class, every neighborhood we go to, the east side to the west side, everywhere.
Again, now this is DHEC's COPE program. That's Community Opioid Paramedic Education. Now, I did ask EMS which forms of fentanyl they're seeing more here in the county. They told me those illegal pills that are being made. Reporting live here in Greenville this morning, I'm Jarvis Robertson, Fox Carolina News.